National Overdose Awareness Day coming up on August 31st, next Sunday. So I'm here with the Governor's Prevention Partnership Co-President Kelly Juleson and Justin Mehl, the Opioid Services Coordinator for the Department of Mental Health and Addiction Services. Thank you both so much for being here.
Thanks for having us.
So first, let's talk about what this day is all about and why it's so important, Justin.
Yeah, Erica, really it's the world's largest campaign to end overdoses. And it's a call to action for people. It's a reminder that overdoses are preventable. And it's also a way to really stand with these families who are suffering and grieving right now and wrap our arms around them. In Connecticut on the 31st and really all that weekend, you're going to see vigils, you're going to see community events, where people are there to remember their loved ones and to also spread the message that these overdoses are preventable. And this is especially important in Connecticut because we lost 989 people last year.
That number is so incredible. Talk a little bit more about the landscape of opioid use and addiction and how that's changed.
Yeah, I think most of our viewers here would know that really in the past decade or so, heroin's been phased out of the drug supply. And what we're seeing is this synthetic analog called fentanyl, which is causing a lot of overdoses. On top of that, they're putting this fentanyl into pressed pills that look just like stuff you would get at the pharmacy.
Right.
And you can't tell the difference, and it can be incredibly dangerous to use those medications unless they come directly from a pharmacy. On top of that, they add these extra adulterants to the supply that really just complicate everything, veterinary tranquilizers and things like that. And I think we want to point out, too, that most of these overdoses happen at home. Almost 71% are happening at home. So this isn't something that's just kind of happening out in the streets. It's right in our private residences. And what's really heartbreaking is more than half the time, there's someone in the home that could have potentially intervened had there been a conversation, and then they're left finding their loved one.
Talking about intervening, let's shift over to prevention. Kelly, you work a lot with prevention specifically for young people. That's your main focus.
Absolutely, and what Justin just shared is scary.
Yeah.
And so as a parent, I'm always wearing that hat as the mom of 2 young children, is what can we do? And the reality is there's some very simple things that we can do on an everyday basis. Have conversations with the young people in your life around the dangers of drugs and alcohol. This statistic I find so staggering, that a young person whose parent talks to them about the dangers of drugs and alcohol is actually 50% less likely to use than their peers. So don't be afraid of that. If you need information, you can come to us at gppct.org. We can help guide you through some of those conversations, and they can start small by building that connection. Who did you have lunch with today? And build up to these bigger things. The other really important thing in this is to safely store and dispose of your medication.
Right.
Because oftentimes people are starting in their own medicine cabinets or from someone they know.
Yeah, let's talk a little bit more about that. A lot of people have medical procedures done. I had a hip surgery this past year, and you get sent home with multiple bottles of drugs, and so a lot of times you're not using it all. And what you do after that is really important as a parent in your house.
Absolutely, and you need to safely dispose. That doesn't mean throw them in the trash, flush them down the toilet because then it gets into our water supply, or keep them for that rainy day.
Right.
You need to dispose of them with an at-home disposal pouch, take them to your police station if they have a year-round drop box or another location near you where they may have that and they can be safely disposed of, because they do present a lot of risk from a public health perspective, but also an environmental perspective.
Right, that's an important thing to keep in mind. So just quickly recap the event that's happening on Sunday.
Yeah, so there's events throughout the entire community happening Sunday, really starting Thursday throughout the weekend. It's a place to go and even learn about naloxone, which I'd like the viewers at home to know that that's the first thing they can do. Just normalize putting that as part of your first aid kit, because naloxone is the best tool that we have to really extend people's lives and help move forward out of this public health crisis.
All right, Justin, Kelly, thanks so much for being here
Erica.
and all your efforts to hopefully end this crisis.